I welcome you to the video Why Service Quality Matters, Case of Pediatric Ward in a Hospital. So let us try to appreciate the concept of service quality through the example of most critical ward in the hospital, that is Pediatric Ward. I am Professor Jitesh Thakkar, Dean Academics and Professor Logistics and Supply Chain Management at Gati Shakti Vishwavidyalaya, Central University, India's first university in transportation and logistics sector. You can access the intellectual content at the channel Professor Dr. Jitesh Thakkar. It has 3 important playlists: faculty and student development, logistics, supply chain and infrastructure projects, process excellence for manufacturing and service industry. About this playlist, process excellence for manufacturing and service industry, many a times we wonder how the world's leading company, they are different, how they have reached to a particular state, but it is more about their processes, how they make it and how they serve you. Another important question is, are you facing bottleneck in production or service, struggling to consistently delight your customers? So in today's competitive landscape, let us remember, good enough simply is not good enough. And typically, this playlist is meticulously curated for the manufacturing and service industry to experience excellence, efficiency, improvement in productivity, quality, and unparalleled customer experience through well-proven framework of process excellence. Let's get started. Gati Shakti Vishwavidyalaya is established by Ministry of Railway with a mandate to contribute in all the modes of transportation: rail, road, water, aviation, ports, and shipping, with a focus on all 3 dimensions: technology, that is infrastructure; management, that is services; policy and regulations. And university has established strategic collaborations both at national and international level with prestigious organizations like St. Petersburg State Transport University, Russia; Monash University, Australia; JTTRI, Japan; Lucchini RS, SPA, Italy; Defense Forces, Nokia, Plaza India, Airbus, Jacobs, and many others. The vision of the university is innovation-led, industry-driven. University offers programs under the School of Technology and School of Management at bachelor's, UG, postgraduate and PhD level, BTech, MTech, MBA, and PhD, with a special focus on transportation and logistics. This video is quite interesting and it exchanges the views on why service quality matters. And we will try to appreciate this through the case of pediatric ward in a hospital. It is quite complex compared to all other wards because you are dealing with the children, and as we understand, they are like displaced customer in the system. They cannot express their needs. They cannot explain their problem. And all the time, they are expressed and supported by their parents. As this video includes narration on some of the medical terminology and complexities involved in pediatric ward, I acknowledge the inputs received from Dr. Prachi Thakkar, MBBS, on criticality and complexity involved in pediatric ward in the hospital. Let us have a deep dive into the service quality dimension and try to appreciate it through the case of pediatric ward in a hospital. So let us see what is service quality. Service quality typically refers to the extent to which a service meets or exceeds customer expectations. When you go to restaurant, when you go to when you go to hospital, you have certain expectations, latent desires in mind, and when your expectations are appropriately served, you feel satisfied. It's a comparison between what customers anticipate from a service and their perception of the actual performance. High service quality means that the service is delivered aligns with or surpasses the customer's hopes and needs. With this preliminary understanding on service quality, let us try to appreciate the important framework of service quality, how to analyze it, and we will try to appreciate the importance of service quality for the context of pediatric ward, most sensible ward in the hospital. So when we talk about service quality, particularly the most popular model is cervical model, and the key dimensions this cervical model includes are reliability, that is ability to perform the promised service dependably and accurate. Hospital is promising a service, and if they deliver this service in time, accurately, then reliability is met. Assurance, the knowledge and courtesy of the employees, their ability to inspire trust and confidence. Typically, this is very much critical in the healthcare segment because the patient is under fear and anxiety, and when they visit the doctor, hospital, the behavior of the staff and the kind of assurance they exhibit really matters. Tangibles, the appearance of the physical facilities in case of hospital hygiene, cleanliness, availability of the equipments, functioning of the equipments, personnel, communication materials, and so on. Empathy, the provision of caring, individualized attention to customers. We understand in healthcare, doctor to patient ratio is highly skewed, but I, as a patient, would always like to see that I am given the individualized attention because my problem is unique. Responsiveness, the willingness to help customers and provide prompt services, and typically this becomes extremely important when it comes to healthcare. Let us see the pediatric ward, and we really feel happy to see the children. But when it comes to dealing with the children, treating them, we really have to appreciate the courage, tolerance, and the skills of doctors, nursing staff, ward boys, and the other people involved. So, pediatric ward in a hospital is arguably one of the most complex and critical environments. It represents unique challenge. They go beyond those found in adult care setting. And typically this complexity arises from a confluence of psychological, developmental, physiological, and social factors. All four factors are involved. A person is coming with a problem. There is a physiological issue, anxiety, fear, concerns, not able to really communicate the problem, typically the children, psychological issue, developmental issues are there, and there are societal factors, beliefs, ethical considerations. Putting together, it really makes the issue of service quality in pediatric ward a highly complex affair. So let us take a deep dive into the issue and see why this really is complicated. The first issue, when it comes to pediatric ward and service quality, the challenge is unique and rapidly changing patient physiology. Let us see, when you are dealing with the children, you have the vast variety to deal with. You may have a children at the age of maybe 3 months, 2 days, or maybe 10 years old. Just see the criticality. A slight deviation in vital signs, for example, heart rate, respiratory rate, blood pressure that might be acceptable in adult because their body is quite stabilized. It indicates a severe deterioration in an infant. For example, a heart rate of 120 BPM in an adult might be high, but for a neonate, it could be normal or even low if they are in distress. We can see other example, a premature infant, for example, 28 weeks gestation. So here I once again would like to acknowledge the inputs received from the doctor, Prachi Thakkar, and my some of the friends to make me understand this complexity in the healthcare, typically in the pediatric ward, clear. So a premature infant, 28 weeks gestation requires meticulously controlled temperature, humidity, oxygen levels in an incubator due to immature thermoregulation and underdeveloped lungs. There is a risk of respiratory distress syndrome. Administering the same medication and dosage to a 15-year-old with Crohn's disease would have entirely different pharmacokinetic and pharmacodynamic effects when it comes to 28 weeks old infant. The another issue is immature organ systems. So children's organs, particularly their kidneys, liver, are not fully mature at the birth and continue to develop throughout the childhood. And this again impacts their metabolism, excretion. My purpose is to make the complexity involved in the pediatric ward clear and then move this discussion to the service quality model. So maybe incorrect medication dosage can quickly lead to toxicity and maybe aminoglycoside nephrotoxicity in infant due to underdeveloped renal function or maybe subtherapeutic levels. Similarly, we can see the example in infant with severe gastroenteritis can quickly become dehydrated and develop metabolic acidosis and electrolyte imbalances. So I'm just trying to express my concerns about the criticality involved in the pediatric ward. Similarly, we can see the limited physiological reserve. Children have less physiological reserve compared to adults. We can see some of the criticality. For example, a child with sepsis. Typically, as we understand broadly, sepsis is a life-threatening condition that arises when the body's response to an infection injuries its own tissues and organs. So this kind of septic shock with multi-organ failure proceed very quickly, and there could be the example, a child with croup might have barking cough, respiratory problems and distress. And typically the child is not able to really express the severity of the problem. The second issue is diagnostic and communication challenges in pediatric ward. So you have non-verbal patient, as I mentioned. Infants and young children cannot articulate their symptom. They rely on non-verbal cues, grimacing, crying patterns, changes in activity level. They require highly specialized observational skills from healthcare providers. And many a times, misinterpretation of the cues can lead to delayed diagnosis or inadequate pain management. For example, diagnosing meningitis in a neonate can be challenging as classic signs like neck stiffness might be absent. Instead, subtle signs like poor feeding, irritability, or a bulging fontanelle might be the only indicators. If we further go deeper into the criticality involved in the pediatric ward, then there is significant reliance on the caregivers. So parents, guardians are crucial source of information, but their reports many times are misleading because mixed with emotions, subjective, influenced by anxiety, and healthcare team must effectively communicate with distressed parents, elicit accurate history while respecting their emotional state. So, for example, a parent might underreport a child's fear because of emotions due to fear, and conversely over-empathize minor symptoms due to anxiety. The both possibility exist, and you require careful clinical correlation. There are ethical dilemmas and shared decision making. You look at the situation when children are unable to make their own medical decisions, parents act as surrogates. This can lead to complex ethical considerations, especially in the case of life limiting illness, conflicting parental views, or refusal of life saving treatments, for example, blood transfusion for children. So, criticality is navigating these sensitive situations requires strong ethical frameworks, legal knowledge, and advanced communication skills. The third important area, which really makes the pediatric ward highly complex and critical and demands careful service quality management, is psychological and developmental considerations. For example, trauma of hospitalization. Many times, parents, children, they experience significant trauma when they are told that your child need to be admitted. So this psychological impact can affect their cooperation with treatment, recovery, even long-term mental health. For example, a child undergoing repeat chemotherapy session for leukemia may develop significant anxiety and anticipatory nausea, vomiting. These are some of the symptoms, and it may require specific interventions like distraction therapy or guided imagery. Family-centered care is another feature that we need to appreciate when it comes to pediatric ward. And unlike the adult patient, the family unit is an integral part of pediatric care. You need to provide the medications time to time because children, they cannot follow their schedule. And typically, if you see the example, a child is diagnosed with type 1 diabetes. The entire family needs education on diet, insulin administration, and blood glucose monitoring. Ward must facilitate this learning in a supportive environment. Child development, the hospital environment must be designed to promote rather than hinder a child's development, and this includes age appropriate distractions, play areas, access to education, and so on. The fourth important area, which really demands service quality implementation and improvement in pediatric ward, is specialized resources and environment. Pediatric ward require vast array of specialized equipment in multiple sizes like teeny needles, specific tubing, child size mask, incubators, pediatric ventilators, huge set of inventory you have to maintain separately, and as well as child friendly spaces. So the criticality is using adult size equipment on a child can lead to medical errors, injury, ineffective treatment. And the example could be an adult blood pressure cuff used on an infant would give an inaccurate reading and could cause injury. Let us look at some more issues to understand why pediatric ward is extremely critical for service quality management. You need highly specialized staffing. So, pediatric healthcare professionals, doctors, nurses, child life specialists, social workers, they require specialized training in pediatric physiology, pharmacology, and child development, and as well as unique communication and de escalation skills. The criticality could be a general adult nurse and physician may lack the specific expertise to recognize subtle pediatric distress or calculate appropriate pediatric drug dosages. Infection control is one of the very critical issue when it comes to pediatric ward. Children, specifically infant and immunocompromised patients, are more susceptible to infections. Just see the example of rotavirus or RSV, respiratory syncytial virus in a pediatric ward can rapidly spread and cause severe illness, specifically in infants. Considering all these complexities with some of the medical examples which I could gather through my interaction with the doctors, I realized that pediatric ward is a micro environment that must cater to an incredibly diverse and vulnerable patient population, each with unique needs and highly dependent on their family unit. This inherent variability and the potential for rapid clinical change, coupled with emotional intensity involved, make it one of the most complex and critical areas of hospital operations. If you just see the framework, then it's very important to ensure high service quality in a pediatric ward. And it is not just about patient satisfaction. It's a critical factor impacting clinical outcomes, patient safety, and the overall well-being of children and their families. And broadly, if you see the framework, then you have quality domains where evidence-based practices, actionable information system, functional referral system, all this becomes part of managing your pediatric ward. The other is the quality standards. It's a broad definition, what is expected to be delivered. Quality statements, concise prioritized statement designed to drive measurable quality improvement. What is your tolerance to the medical error? And quality measures. So it's a criteria that can be used to measure and monitor whether quality of care is provided or achieved or not. If you go deeper into the case of for ensuring service quality, typically for the pediatric ward in a hospital, then this ward has unique vulnerability of the pediatric patients. So as I mentioned, children cannot always articulate their needs. Dependence on the caregivers and higher risk of medical errors are some of the important factors. Similarly, impact on patient and family experience. There is a reduced anxiety and fear. So hospitals can be frightening place for the children, and high quality service environment characterized by children-friendly spaces, empathetic staff can really help the patient to recover faster. Increased trust and confidence, empowered families. You give them assurance, empathy, treat them well, positive word of mouth reputation. All this enhances your service quality dimension, typically for the case of pediatric ward in the hospital. The third important dimension is improved clinical outcomes and patient safety. So what is the level of accuracy in diagnosis and effective treatment? Reduce complications, whether it is the administrative procedures or it is the treatment. You reduce the complications to avoid the error and make your patient, family comfortable. Better adherence to care plans, medical schedules, follow-up instructions, lifestyle recommendations, and early intervention for developmental needs, typically, which has profound impact on child's future. The fourth component that we care when it comes to pediatric ward is operational efficiency and staff morale. So reduce rework and efficiency as a part of your service quality program. Service delivery must be reliable, which can minimize the errors, need for rework, improve staff satisfaction and retention. Ultimately, they are dealing with the human being and their emotions. So your staff morale must be high. They should not be overwork, reduce burnout, and lower turnover rates so that their skills can be retained. Enhance professional development. So you are adapting to the new treatments, technology, and your staff also need to be educated and trained to improve your service quality in the pediatric ward of the hospital. So broadly, having appreciated this, we can summarize that ensuring service quality in a pediatric ward is not a luxury, but a fundamental necessity. Not like other businesses, restaurant, or maybe hotels, you can say that it's a luxury, but here it's a fundamental necessity. It directly addresses the unique needs of children and their families, foster healing environment, drives better clinical outcomes, enhances patient safety, and ultimately strengthens the hospital's reputation and operational effectiveness. If you look at the service quality model, then Cervical model typically emphasizes on four most important dimensions, and a pediatric ward in the hospital must decide the appropriate key performance indicators to ensure reliability, assurance, tangibles, five components, empathy, and responsiveness. So the core of cervical is measuring the gap between patient family expectations and their perception of the actual service received. If you come across any negative gap, then it indicates that perceptions fall short of expectations, and this will be called as quality deficit. So if we just see the gap model of service quality, then you have the expected service that is in the mind of the customer. You have perceived service, service quality, and customer driven service design and standard, and company perception of the customer expectations. You can see that 5 different gaps can arise when these gaps are not appropriately handled. It leads to patient, typically in case of healthcare system, dissatisfaction. So 4 gaps, typically there is a gap between expected service and company perception of consumer expectations. So I am perceiving that my customer would feel happy, my patient would feel satisfied with this level of service, and actually the expected service is different, and hence the gap 1 arises. If you look at gap 2, then company perception about the customer expectations and customer driven service design and standards, you have tapped the customer expectation, but when it comes to design of the services, there is a significant gap, and hence your service delivery gets impacted, and that is where subsequently gap 3 is also realized. And similarly, you can see that service delivery and external communication to customer, there can be the differences, and gap 4 may arise. So typically we can say that customer and company, there should not be much divide. A healthcare service provider typically which runs their operations on trust, confidence of the patient, these gaps should be minimized through appropriate service quality management as much as possible. So if we apply the cervical model typically to the pediatric ward in the healthcare system, hospital, then first thing is to appreciate the tangibles, that is the physical facilities, equipment, appearance of personnel, and some of the perceptions involved. You may convert it into questionnaire to identify where your pediatric ward services really stands. So pediatric ward is visibly clean and well maintained. That is one of the expectations of the patient. The equipment used for children looks modern and safe. The staff's uniforms are clean and professional. The waiting areas are comfortable and have children-friendly distractions. And the rooms are decorated in a way that is comfortable for the children. So regular audits of cleanliness, equipment maintenance logs, and staff appearance can really help the pediatric ward to enhance their service quality dimensions. Second is the reliability, second dimension of cervical model. It is the ability to perform the promised service dependably and accurately. Expectations could be parents expect that medication will be administered at the correct time and dosage, and that test result will be accurate and delivered promptly. This is something where your reliability dimension comes into play. Some of the perceptions that you may like to measure for your pediatric ward: my child receives medication exactly when it is supposed to. Test results are provided in a timely manner. The nurses consistently follow all protocols for my child's care. Doctors and nurses are knowledgeable and perform procedures accurately, and so on. The third is the responsiveness, willingness to help customers. Typically, here it is your patient, and your patient in a pediatric ward is child, and provide prompt service. So, couple of expectations or perceptions to measure. Nurses respond quickly when I press the call bell. Staff are always willing to answer my questions patiently. I do not have to wait long to see the doctor when needed, and the hospital promptly handles any complaint or concern I raise, and so on. The fourth is the assurance. It is about knowledge and courtesy of employees and their ability to inspire trust and confidence. The perceptions that help you to understand the service quality at your pediatric ward. The doctors and nurses seem highly knowledgeable about children's health because they all want customized health care. And when you visit the children, you should have history in mind, or you should refer the history and immediately say interact with the parents, and they would have a lot of curiosity. Staff are always courteous and polite. I feel completely safe and confident in the care my child is receiving. Staff clearly explain procedures, and my child's privacy is respected. The fifth component is empathy, caring, individualized attention to customers. The items, perceptions that you would like to measure to improve the service quality of the pediatric ward is: staff show genuine concern for my child's comfort and well-being. Staff try to understand, address my child's fears. I feel that staff truly care about my child as an individual, and staff listen attentively to my concerns and questions. So, putting together issues and challenges in pediatric ward in the hospital present a unique set of challenges and issues due to the distinct physiological, psychological, and developmental needs of children, coupled with the emotional involvement of their families. So, number one, complexity and diversity of pediatric care demands the management of service quality, and hence the application of service cure model. Second, communication and coordination issues. Third, resource and time constraint. And fourth, legal and ethical complications. So, if we just elaborate these issues to further appreciate the service quality more into medical terminology, then medical and clinical challenges. First is the varying physiological and pharmacological responses. So, let us say you have 3-month-old infant with bronchitis, and typically this is the viral lower respiratory tract infection, and will respond differently to oxygen therapy, bronchitis than a 10-year-old with asthma exacerbation. So you have a complexity in administering the dosages, drug dosages, even though you are dealing with the population of children in the pediatric ward. As their age varies, the dosages and treatments extensively vary, and it's not like adult. Second is difficulty in diagnosing and assessment. You have a non-verbal toddler with appendicitis, might present with generalized abdominal pain, irritability, decreased appetite, rather than classical localized right lower quadrant pain seen in the adults, and diagnosing intussusception, telescoping of the bowel. Typically, it's a serious condition where part of the intestine folds into itself like a telescope, causing blockage, really becomes difficult to diagnose. So children, especially infants and young children, often cannot articulate this symptom, and then the doctor's role, healthcare provider's role, become extremely critical in ensuring the service quality. Rapid clinical deterioration, a child with sepsis, typically it's a condition, life-threatening condition, which arises when body's response to an infection injured injures its own tissues and organs, dehydration, and so on. Infection control and nosocomial infections. You may encounter the children, especially those with immature immune system, and typically you are dealing with highly susceptible to healthcare associated infections and central line associated bloodstream infections or catheter associated urinary tract infections kind of situations. And the challenge is maintaining strict hygiene, isolation protocols, environmental cleanliness, and so on. Similarly, managing chronic and complex conditions like cystic fibrosis is a generic genetic disorder that primarily affects the lungs and digestive system by causing buildup of thick, sticky mucus. And when you are dealing with this kind of situation, the challenge is to ensure continuity of care, coordinating multiple specialties, managing long-term complications, and so on. Psychosocial emotional challenges. So, addressing child's fear and anxiety, a 5-year-old facing venipuncture, blood draw, or a surgical procedure like tonsillectomy might experience intense fear, and challenge requires specialized child-friendly treatment. Parental stress and anxiety is another dimension where service quality management becomes important. So parents of newborn in the neonatal intensive care unit and ICU with prematurity and respiratory distress syndrome leads to a lot of distress and anxiety and guilt. And healthcare provider must not only care for the child, but also provide emotional support, clear communication, and education to the parents. Communication barriers, typically type 1 mellitus, diabetes, challenges adapting communication styles to the child's development level and parents' understanding, ensuring clarity, maintaining development and education, challenges providing opportunities for play, education, and so on, and ethical dilemmas. So maybe decision regarding withdrawal of life support system for a child with a devastating neurological injury, and your parents may refuse because of religious belief, and healthcare provider in the pediatric ward really need to deal with this ethical dilemma. There are operational and resource challenges which needs to be addressed appropriately for managing the service quality. One of them is staffing and specialization. So demand for highly specialized pediatricians, pediatric cardiologists, neonatologists, pediatric intensivists, different kind of specializations. It's another challenge for the pediatric ward. Infrastructure equipment. Many public hospitals, particularly in smaller towns or rural areas, lack specialists, pediatric equipment like pediatric ventilators, infant warmers, and this poses another challenge on service quality in pediatric ward. Financial constraint, high cost of treatment, affordability of the care, cultural beliefs and practices, so severe acute malnutrition, SAM or pneumonia, and the challenge for the healthcare in pediatric ward is to provide, say, culturally sensitive, build trust with families and so on. Follow-up and continuation of care, ensuring children discharge after treatment for conditions like rheumatic fever, receive regular penicillin, prophylaxis to prevent recurrent attacks and cardiac damage. And the challenge is establishing robust follow-up mechanisms, community health worker networks, and telemedicine options to ensure continuity of care as a part of your service healthcare quality management in the pediatric ward. So to conclude, we have gone through the challenges involved in the pediatric ward, which is a highly complex unit of your healthcare system. And to ensure the appropriate service quality, it is important for the hospital administration to set the appropriate cervical based service quality assessment in place and see that your service quality at the pediatric ward ensures tangibility, that is the visual impression counts, reliability, dependable services, responsiveness, prompt assistance, assurance, building trust and empathy, personalized attention and care. Gati Shakti Vishwavidyalaya is India's first and only university in transportation and logistics sector, and it is offering the programs at undergraduate, postgraduate, PhD and executive training to enable nation's aspiration to reduce its logistics cost from 14% to 8 to 9%. Thank you for your interest in learning the critical issues in process excellence for manufacturing and service industry. We will keep exploring more issues through this platform for the benefit of industry professionals striving to achieve excellence in manufacturing and service sector. Thank you very much.